Good evening and welcome to In Your Right Mind, a weekly radio show that discusses an array of behavioral health issues. We all have issues, so let's start talking. My name is Stephanie Wilder-Taylor.
And I'm Dr. Tanmoy Sharma.
This evening, we're going to talk about pharmacogenetic testing, what it is, why it's used, how it can help healthcare providers to determine how a person will respond to a particular drug or medication.
Psychiatry is a specialty that's a combination of art and science. And the art part of it is doing descriptive diagnoses and out of the many medications available for, let's say, depression, choosing one. The science is really trying to figure out what is personalized to the specific patient in front of you. And that's done by getting some specific information about the family history or about the specific side effects that the person may have had with other drugs or responses that are good from other drugs, also the specific history, but finally getting some idea of the biology of that specific patient and most notably the genes that control responses to medicines in psychiatry. So that's what we're trying to do, is to get specific tailor-made information about an individual patient. You might call it personalized medicine.
But I think that the major benefit of genetic testing in psychiatry, as far as the idea of personalized medicine, is first and foremost to understand that these medications, when not used properly, can produce very significant adverse effects. And we're talking about adverse effects that really span sort of both psychiatric realm and also physical realm, meaning that some of the drug effects of commonly used psychotropic drugs produce serious medical conditions such as metabolic syndrome, obesity, and increased risk of cardiovascular disease. So I think we first need to be cognizant of the fact that these medications are not as safe as one would normally assume that they are, and that doing biological testing on a case-by-case basis helps the clinician have a higher sense of vigilance about avoiding those side effects, because remember, the first thing that we do in medicine is first do no harm.
I think the listener should realize that genetic testing in psychiatry is not going to be a yes-no type of thing. First of all, it's not for diagnoses, and second of all, it just changes the odds that you either will respond to a medicine or that you will tolerate a medicine. It doesn't say with great certainty, for sure you need to take this medicine, it'll always work, or it will never work. The idea is that we balance the weight of the evidence, and that's where I got to before, using science and art. We get a feeling for intuitively what a patient needs, but then the science helps balance that and weigh it. So among many options, if you have a test that says it's more likely that you're going to respond to something or tolerate it, why wouldn't you use the medication that's indicated that way?